27th District here, Flint and Genesee County. I want to welcome everyone to this roundtable discussion, and thank you all for coming. And thank you also to my colleagues, Senators Santana, Hertel, and McMurrow, for being here as panelists with our panelists who are going to introduce themselves shortly. And really want to thank everybody who's been involved in the RX Kids effort here in Flint and really across the state. It's a wonderful story that's providing a lot of impact. I'm proud that we're doing this roundtable here in Flint where we first launched RX Kids, and it's also where it was conceived. I think folks know Dr. Mona playing a huge role in that, but as I've heard her tell before, really the inspiration came from the mothers that she was working with. So it's exciting that this program that is expanding and that we're hoping to continue to expand was really birthed by Flint mothers. A key component of the buildings block legislation that is being advanced by my colleagues in the Senate. And so to kind of recap a little bit about RX Kids, it's a program that provides cash prescriptions to pregnant mothers and babies. $1,500 as a prenatal payment and $500 per month. In Flint it's for 12 months postnatal. In some other communities that have started up at 6 months. And that means money can go where it's needed, whether that's baby formula, or if it's rent, or utilities, or diapers, whatever that child may be needing. And I think what this program recognizes is that by investing now to improve the trajectory of the life of a child, it means you don't have to invest as much later to change a trajectory. An ounce of prevention is worth a pound of cure. So I want to thank my colleagues, particularly Senator Santana, for the initial outlay of $16.5 million as match money with private philanthropy, and I believe actually the first private philanthropy to come on board was the Ruth Mott Foundation. No, okay. I was close, all right, sorry about that. But an important piece was from the Ruth Mott Foundation, and also we have the CS Mott Foundation. So we launched in January of 2024. Over $10 million has gone out so far. There's about 2,000 enrollees. And we're going to hear about the impact from our panelists. But and I won't go into all of that yet, because I think Dr. Mona is going to talk about some amazing results. Last state budget, we expanded to other communities. Again, thanks to my colleagues here. Kalamazoo, Eastern UP, Pontiac, Clare County, and my understanding is soon we'll have some more communities in Wayne, in Oakland County, and in Ypsilanti, in Washington. So that's not the end of where we want to be, and I'm going to turn it over to Senator Santana to talk about where we're trying to go.
Hi, well, good afternoon, everyone. I'm State Senator Sylvia Santana from the 2nd District, Detroit, Dearborn, and Dearborn Heights, and a small portion of Allen Park. It is an honor to be with you here today to talk about a wonderful program that was launched right here in the heart of Flint. RX Kids, as you know, it is an evidence-based program. We found that it helps to support families during those critical times in a child's life. By reducing food insecurities as well as lowering childhood poverty rates, which we know in our state are significant. And so one of the things that really is important to a family is making sure that they have the ability to have the money necessary in order to sustain that child's life at the time of birth for those critical years of 0 through 5. And so this program was designed to make sure that families have cash assistance and that they can utilize those dollars to stabilize their housing as well as other needs for the family as well, like making sure that they can pay their rent, also improve their maternal and health outcomes, making sure that families and moms and babies don't have to stress out during those most critical times. I know as a mom, I want to make sure that I did not have to worry about how I was going to purchase formula or make sure that I could make sure my child could have the necessary needs as far as daycare and other essential things as just a child care seat and a bed for them. So those are all things that are really important to families. And so this program will provide that cash assistance, and we've seen it work for so many families throughout this region, and also as the expansion happens throughout the state. But my role as the DHHS chair is to make sure that we have the necessary critical essential needs with resources from birth to earth. And so the RX Kids program is a part of that birth aspect of this. And so we have expanded this program, as mentioned, to Flint, Kalamazoo, the Eastern Upper Peninsula, as well as we want to see this program throughout the state of Michigan, because it is definitely important to make sure that everyone has a healthy upbringing in our state as well. We've heard from so many families throughout the course of the time in which cash assistance has been eliminated essentially by Republicans over the years. And so that is a critical part of every family's life, is making sure that they can just buy the necessary essentials such as diapers. These are real families, these are real people, and we know that it is hard, and if you don't have the money to support your family, it can be stressful. And so that stress also goes on to the child. If the mom's stressed out, the child will experience that, and that also impacts their developmental stages of their life, which 0 to 5 are the most pivotal years for kids. So we introduced Senate Bill 309, which allow for this program to not only be a program that is appropriated through the budget, but also become a statewide program and also mandated into law. And so this program would also impact the families in places like Detroit, rural communities, and other areas, suburban communities as well. When we're looking right now at so much uncertainty in our communities across the board when it comes to the federal level and throughout the state of Michigan, I believe that this is a crucial step in the right direction to making sure that we are tackling poverty, not only in just poor communities, but especially Black and brown communities where they see a lot of the impacts of governance being something that is not supported for those communities. I think it's important to make sure that we uplift that. If it happens in a Black and brown community, if it catches a cold, or it catches a cold, everybody else catch a cold, we catch the flu. And so this is important to making sure that next steps that people have those dollars to be sustained. So what I want to say in closing is just that it is time for this program to be expanded. It is time for families to have that security. And it's time that we continue to prioritize the people of Michigan. And part of that is making sure that programs like RX Kids continue. So thank you, and I'll pass the mic along to my colleague, Kevin Bertel.
Thank you very much, Senator Santana, and to all my colleagues here who have done really incredible work on this programming to get it to where it is today, and also try to expand it to other areas across the state after we've seen the success that it has had in areas here like Flint. I don't approach this issue or any of these issues strictly as a legislator. I approach it from my lived experience as a parent as well. Just this morning, as I was taking my 8-year-old to school, my wife was taking my 5-year-old to the emergency room because he was having somewhat of an asthma event from a cold that he has, and to get a breathing treatment. Now, for us, that is an inconvenience in the morning, right? As I'm heading out the door, and you're trying to get one kid to school, another. And if it's also a bill that will show up later for that emergency room visit, and families struggle with issues like that every single day across all of our community. I like to think that we've somewhat hit the lottery lately because my family is finally to the point where we have our youngest in kindergarten, our oldest in 3rd grade, and so I no longer, for the first time in 8 years, have a child care payment or a preschool payment. But I also know that that is a struggle for so many families across our state to make sure they have proper care for their children every single day. I've lived that as well. When you think about when a new baby comes along, that is $20,000 a year in expenses for a family. And nothing we're seeing is getting less expensive. It's only getting more expensive in so many aspects of what you have to buy in order to get by for those first 3 years. And so we have families, there's no doubt, that are struggling. across the state. They are making decisions on whether to start a family or grow a family based on if they can afford those expenses. So from a state perspective, I believe we should be doing everything we can. RX Kids is a huge successful step forward to make sure we're addressing the needs of those families. Addressing child care, affordable child care, is another step that we need to take to make sure families across our state have the support they need. But nothing like this ever happens fast or fast enough for the families that need it. I'm so proud of what we've been able to get done at this point in a relatively short period of time, and the growth that will come from these programs over the next few years as we work on future budgets and provide more funding across the state. So I'm very proud to be here with my colleagues and so many folks from across our state that have worked really hard on these issues. And I will kick it over to my colleague, Senator McMahon.
Thank you so much. Good morning, everyone. I'm State Senator Mallory McMorrow, representing Michigan's 8th Senate District, which includes Royal Oak Township. Royal Oak Township is one of the next communities joining RX Kids. It was the first majority Black municipality founded in Oakland County, and I'm just really excited to see this successful program expand to reach more babies, more families, and we are about solutions, and that's something that is really exciting for all of us in this room. I'm a state senator and a mom, like all of us up on this panel. We have kids of our own, and I'm here because Michigan families are in crisis. And it's not enough just to talk about it, we have to provide solutions. To be clear, the crisis that we face is real and it's urgent. Michigan has lost 40% of its child care capacity in just one decade. That's double the national average, and it's crushing our working families. Parents are being forced to choose between their career and having a family, exactly like Senator Hertel said. Michigan currently ranks 39th nationally in workforce participation, and the child care shortage costs our state $2.8 billion annually in lost productivity. But what's different about us being here today is we are not just identifying a crisis, we are providing real, proven solutions that have been piloted, invented, and proven right here in Michigan. In addition to the incredible work of RX Kids, we're also here to talk about the TriShare Child Care Program. The TriShare program is already working. Since 2021, over 260 Michigan employers have joined this first-of-its-kind program that splits child care costs 3 ways between the employer, the employee, and the state. What is the result? Is that parents are paying only 1/3 of what they would pay alone, which saves parents thousands of dollars every year. We've already served over 800 families and saved them more than $10 million. Now, when you are considering whether or not to add a child to your family, that is savings that really adds up. Right here in Genesee County, employers like the Greater Flint Health Coalition and Genesee County government are already participating, proving that this works in communities all across the state. Our building blocks legislation goes even further. We're codifying and expanding TriShare statewide while also supporting child care providers by tying reimbursement rates to inflation. Think about that. As the costs continue to go up, we need to make sure that our providers can continue to keep up because they're doing the most important job in the world, which is watching our kids. This isn't just policy, this is about families. It's about parents who shouldn't have to choose between a paycheck and picking up their kids. It's about children who deserve quality care while their parents work to build a better future for them. Other states are watching to see what Michigan does next. Now, we are a leader, we're an innovator, and other states are watching to see if we are able to succeed. The question isn't whether or not we can afford these programs, it's whether we can afford not to. Every day we wait, there are more parents who are leaving the workforce, more child care centers that are closing, and more families who are facing impossible choices. Today we're all here to say and show that our littlest residents deserve so much better, and that we actually have a plan to deliver it. So with that, I will turn it back over to Senator Cherry, who will start the discussion.
Thank you, Senator McMurrow. And now I'd like to ask our panelists to introduce themselves, and we'll start with Dr. Mona.
Hello, it's great to be here. My name is Mona Hanna. I'm a pediatrician here in Flint, Michigan. My clinic is actually just upstairs. I'm a professor at Michigan State University, the Associate Dean of Public Health, and the founder and director of Ours Kids. And I just want to say thank you to our Senate leaders for being here today and for being absolute champions for our youngest Michiganders. Want to say hello? Say hello. No, okay. We're just gonna eat the mic. Hello, thank you for having us. My name is Celeste Lord Timlin, and this is my 15-month-old daughter, Siobhan. Say hi. Yes. And just being recipients of RX Kids, Siobhan is our first child, my husband and ours, and we couldn't imagine the cost of childcare. I mean, you kind of come up with sums in your head, and you're like, oh, things are expensive, diapers are expensive, daycare is expensive. But our daycare down the street costs $1,300 a month. Tell any middle-class family to adjust their budget and then also pay for your hospital bill, also pay for preparing for a baby. And, you know, for us, coming from a middle-class family where we both enjoy our jobs, we work 9 to 5, and then to have those expenses, you know, there was a lot of stress in that early part of pregnancy, and that was before Ours Kids was announced. But when Ours Kids was announced, and I found out that I could qualify, it really made the future more manageable. I really thought about how we could use this opportunity, the year of the prescription, to adjust our budget, adjust to how we were going to balance our finances to make it feasible. And you know, it's still hard. I couldn't do a second child right now at that same cost, but I'm able to enjoy serving my community, working at the City of Flint, and I'm able to enjoy being a mom. And I think that's really the gift that this program gave me. Thank you.
Hello, I am Emily Laidlaw, and I am Deputy Director at Michigan's Department of Lifelong Education, Advancement, and Potential, otherwise known as MILE. And we are laser focused on accessible, affordable care for families that meets their needs, including overseeing the TRISHARE program. So we're thrilled to be here to support putting TRISHARE in statute and continue our partnership with RX Kids.
Thank you. Thank you, and good morning, everyone. Senator Cherry and my former colleagues in the Senate, thanks for having me and letting me be a part of this. I'm the President and CEO of the Greater Flint Health Coalition. I spent about a decade in Lansing, worked in state government, and I'm also a neighbor of Celeste and Siobhan. And also, I think very importantly, I'm a parent. I know exactly the issues that we're talking about here firsthand, whether it's child care, the cost of having a child, and the increasing costs that we're all dealing with. And I think it's important to have this discussion. And as Senator Morrow said, the discussion is important, but the action, I think, is even more important. And I applaud my colleagues for the work they've done on this and the work they're continuing to do in the future about these issues. Thank you.
Good afternoon, everyone. I'm Raquel Team. I'm the president of the Ruth Mott Foundation, and it's really an honor to be here representing the foundation and talking about this innovative and important program, RX Kids. We are a place-based funder here in Flint, Michigan. We're a private family foundation, and we weren't the first funder, but this grant to RX Kids has actually been the largest single grant that we've made because we believe so strongly in the principles of partnership, of providing seed funding for innovative solutions, for getting to these issues and getting to sort of that preventive and root cause piece of what we've heard already and what you're going to hear through some of the data. It's an honor, again, to be part of this important conversation, and we think this has great potential, as you've already heard, and you'll hear some more with some of the specifics to really be scaled well beyond Flint. And Flint has been an innovator in a lot of different programs, so we're proud to be your support of that.
discussion. We'll start with Dr. Mona. And you've talked a little bit about the origins, but also, I think in the past week and a half, you released like the initial findings. So as this program is going on, we're not just implementing the program, but we're also studying the impacts to see what that means for folks. Can you talk a little bit about that?
Absolutely. So, ARCS Kids launched here in Flint in January 2024 because of Senator Cherry, thanks to his leadership, thanks to the Senate leadership that appropriated some TANF dollars, cash assistance dollars, to match other philanthropic dollars. So we started here in Flint, and it was like this impossible idea to finally bring a solution to the pathogen of poverty. For so long as a pediatrician here in Flint, I've been band-aiding. I've been doing too little, too late, because we haven't had the tools to be able to actually prevent poverty. And it is frustrating to care for little babies like this one and not be able to truly treat something that makes them sick. So that's why ARCS Kids started here. It came from mamas and families saying, yeah, we have all these amazing things in Flint, but what about the, it's hard to make our ends meet. It's hard to buy diapers. It's hard to afford transportation. It's impossible to afford childcare. And knowing all these things, scientifically, we know it makes it really hard for kids to be healthy and successful. So that's how ARCS Kids was born. It was inspired by what other countries do. 70% of countries do child cash transfers. This is not a new genius idea. This is done around the world. And it was also inspired by what was happening nationally in 2021. That's when we expanded the child tax credit during COVID. Millions of families got unconditional monthly cash allowances, and it dropped child poverty to the lowest level ever in this nation. Millions of kids came out of poverty, and we saw incredible outcomes: more housing stability, food security, less child abuse and neglect, decreased stress among families. And that, unfortunately, was not renewed by the U.S. Senate by one vote, and millions of kids went back into poverty. So that also became a proof point, inspiring all of us to say, hey, we can keep doing this. We don't have to be okay with poverty. We can fix this by big, bold, systemic solutions. And that's what ARCS Kids is. Once again, as Senator Cherry says, it is a program that provides every pregnant mama in the community $1,500 in the middle of pregnancy, and once a baby's born, it's $500 a month, either for 6 months or for 12 months, depending on that community. And it is laser focused on moms and babies, because it turns out that that is the poorest time in people's lives. The poorest time in people's lives is when folks are pregnant because of a drop in income, they have to come out of the workforce, and the added expenses of having a kiddo. And what's kind of shocking is that this poorest time in life course is also the most consequential when it comes to child development. Siobhan's brain doubles in size in her first year of life, literally doubles in size. She's got this soft spot over here because her skull is in pieces because her brain is growing so much. This kind of, once again, this critical moment, what happens in this really, really important time period shapes her whole life course. So ARCS Kids is once again laser focused on this critical window when families are poorest, when it is most developmentally consequential. Once again, started in Flint and had incredible success right away. Already have a near 100% take-up rate, which is amazing. Almost every baby that should be in the program is signed up in the program. And because we have that high take-up rate, we can do some really cool research, because we are academics at heart, to see how the program is impacting families. And we learned quite quickly that it's helping families make ends meet. They are able to go to doctor's offices. They are able to pay rent. We had no evictions last year in our survey of low-income moms. This is amazing news. We had less back-owed rent. Families are more able to buy the food they need to buy, so we had improvements in nutrition security. We've had population-level improvements in maternal mental health. So moms have less postpartum depression, less anxiety, less stress. We repeatedly hear that families can breathe. A weight has been lifted off their shoulders. They have time, they have bandwidth, they can parent, they can be with their little kiddos. and be present and attentive. In big population level data, and this was research released last week, we are seeing massive improvements in birth outcomes, population level improvements, and I would challenge anybody out there to find anything out there in the science that matches what we've been able to find. After launching RX Kids, we had improvements in birth weight. Babies were born bigger. We had a decrease in premature deliveries, and because of that, we had less NICU admissions, which are admissions to the neonatal ICU. Mamas had a massive increase in prenatal care. Mamas are going earlier and more often. We even had less smoking in the 3rd trimester. All of these things are translating into population level improvements in healthier babies. And healthier babies mean healthier kids. And healthier kids mean healthier adults. And that's also translating into short-term cost savings. Just the prevention of NICU admissions in Flint saved about $6 million a year. If we translate those findings, just the birth outcome findings to the rest of the state, that's about $500 million in savings just on those birth outcomes. And we're also seeing lots of tremendous outcomes. So not surprising, we're seeing fantastic evidence. We're seeing healthier babies, happier families, and really building a foundation for future success. I will stop there because I can keep talking forever.
I love that we can see the direct impact right here in just the cutest panelists I've ever seen on a panel. I heard as part of the conversation we talked about RX Kids, we also talked about the cost of childcare. So I want to ask both the mom and Emily from Miley, because TriShare is something that is part of our building blocks legislation. And Miley recently uplifted a national case study from Results for America, recognizing the TriShare program as an innovative, effective, and leading model for expanding access to affordable childcare. I'm wondering from both of your perspective, Emily, can you speak a bit more about that new study? And then from the parents' perspective, and I share this same pain. My husband and I recently found ourselves just missing the gap week recently between summer school and the first week of school, and we found ourselves scrambling for childcare that week. And even if you have all the resources, it is so stressful. So I would love if you could talk a little bit about the personal impact, and then Emily, if you could talk about why this program is a national model.
Sure. Yes, we were.
I think you have to hold it very closely. My gosh.
Can you guys hear me? Yes, Michigan TriShare was uplifted by Results for America as a national case study as an innovative model to address childcare. What we know is that it reduces the cost of childcare by 66% for families and is a incredible benefit. We've heard from businesses that have said that this is the most important benefit that they can offer their employees. Even probably they told us tied with health insurance, which is really speaks to the need there. This benefit was thought of in West Michigan by a group of businesses and families and childcare providers who were looking at ways and innovative ways to attract and retain talent in the workforce. During the COVID-19 pandemic, Governor Whitmer and the legislature piloted My TriShare, and ever since then, the legislature has continued to increase funding so that we can serve more kids and families across the state. It's been really successful with almost 1,000 kids enrolled right now in the My TriShare program, and we're continuously working with businesses that want to launch the program in their business in order to attract and retain top talent, as well as help families succeed when they have to live with that home.
Thank you. So to speak more on childcare and just the need for it, as I was talking about before, the cost of childcare, it's one of those things where we can't negotiate. We can't really even. I know. And she's having a good time because she has a great childcare down the street. When I think about how there were waiting lists everywhere to get on our childcare or our early childhood care center that we have, we had to be on a 10-month waiting list, and I was 4 months pregnant. So there's this rush, right? It's almost like getting your baby into college. You're like, I have to apply to all these places. Maybe I'll get into some place. And then, you know, when you do, you're like, I'll pay you whatever, because I've been on this waiting list. And so it's just like there's no critical thinking, there's just doing it. And all I know is that it's kind of limited us to where we're like, okay, if we're gonna invest in one child, it makes it really hard right now to have a second. And you know, there's other things in my husband and I's life where we're like, okay, we have to think about career development so we can continue to afford things with inflation. I'm in a dual master's program, and you know, I'm graduating in December, so I have to focus on that as well. So when I think about childcare, like, we're so grateful because we appreciate the teachers and the caregivers we have, but at the same time we feel like we're at the mercy of the system. It's either we pay up, or you know, I give up my master's program and then stay at home, and I become a stay-at-home mom, especially if I had a second child. That's just our reality. And so it's hard to even explain to say when I talk to pregnant moms what their options are. So I'm like, your options are to find a place where you can get on a waiting list, and you just hope you can afford it. So it's not a sustainable model right now.
I know I said I felt like I had lottery after all the silence here, but I'm realizing very quickly that I miss having a 15-month-old. I have a question for, I don't know how to address it other than Senator Anime. So, you know, working a decade in the state legislature, now being with the Greater Flint Health Coalition, we've seen the broad impact that the decisions that we make, the programs that we can invest in advancing have, a direct connection to community health and a real broader impact across all of our communities. You kind of talk to that when you see now the real role of how all these programs impact the health of the community here in Flint.
Thank you, Kevin. That's a great question. Chip's fine, but yeah, I think the question is an extremely important one, and I think the nice thing about the Building Blocks agenda and the work you guys have been doing is they build on each other, and I think that's extremely important. As Celeste was mentioning, the system at times feels overwhelming. It feels like it's unsustainable, so you're going to have to put multiple programs in place to make sure the families get that. So what we do with the Greater Flint Health Coalition is always giving somebody a quick kind of elevator pitch, because we deal with what they call the social determinants of health, the things that are stopping people from getting healthy, the kind of barriers in the way of getting yourself healthy, of improving and going forward. And some of the programs we're talking about today, and many others that you guys have worked on over the last 3 years in particular, I think are really critical. What we're seeing with RX Kids, Dr. Mona mentioned a lot of statistics, and on a daily basis we see the actual, as was mentioned, we see the actual kind of fruits of the work in the children and the moms, and you know, you can see that the feeling of overwhelmingness is less so. It's always going to be a little overwhelming if you're a new parent, but we have resources in your bank account, not have to worry about, as Dr. Mona talked about, being evicted or not having enough food or making choices. You guys are helping to relieve those choices, and the work you're doing to try to expand it statewide, I think we're going to see a major impact, not just here in Flint, but all across the state, in folks being able to choose what they want to do. Often you feel like you're forced to have to make a decision. As Celeste mentioned, my wife was able to take a year off of teaching that first year that we had our son, but we didn't have much of a choice. We just didn't have access to childcare. We were able to get into a similar program, the same program that Celeste was talking about, and there are just some tremendous programs here. John, we've talked about it with your children, programs you've been and support local child care providers, because as was mentioned before, it's critical to make sure that the folks that are taking care of our most vulnerable, our most precious, our children, are paid at least a wage that's livable. You hate to have somebody taking care of your children who's struggling in poverty themselves. So I think, these two programs particularly, you guys have worked on a bunch that are really doing important work. These two critical components of the Building Blocks agenda, I think, really empower families. That's what we're really trying to do here, is empower families to make their own choices. You shouldn't be forcing them to have to make a choice about quitting your job, or quitting your master's degree program, or all these other decisions you have to make. Every day we make tons of decisions, but if you can have a deposit into your account once a month and more affordable child care, you can make those decisions based on, as Les was mentioning, critical thinking, based on what's best for you and your family. And I think that's really important. I appreciate the opportunity to talk about it, because we're seeing the benefits of these programs firsthand, the families that we get on a regular basis that are just doing a little bit better. I think that's really important.
Hello? Can you hear me? Yes, thank you for that, Jim. It is really important and critical to this program and many others that we fund in the state government. But I think one of the key components to the RX Kids program is there's no barriers to who can receive these dollars. And so one of the things that I think is really relevant is the fact that we have a great philanthropic community and nonprofit community here in the state of Michigan that really champion this program in order to make sure that families, no matter if they qualify for TANF or not, are able to receive these dollars for those critical years of a child's life. So Raquel, I just want to ask you to speak on the role of the foundations and the nonprofit partnerships that also help to support the RX Kids program across the state of Michigan.
Sure. Thank you. That's an important point. I want to back up a little bit to piggyback on some of the earlier comments that have been made around some of the other components of the support by all of the partners. And that is, we're a place-based funder in Flint, and we fund in areas that the community has voiced as priorities. And Jim spoke to, people having agency and making choices, and so when you get a cash payment, you make choices based on what's important at the time. Nobody's telling you, today you need to buy diapers, or today you need to buy formula, because every day you're making those decisions for yourself. And that's a really important part of how the Ruth Mack Foundation funds and how we set up our funding priorities, that people know what they need on a daily basis and make those decisions. And we don't need to make those decisions for them. We need to provide agency and flexibility to be able to do that. So I wanted to make that point about how we function in the community. The other piece that I think is really critical for philanthropy is to provide what I call risk capital. And that's when you have innovative programs that may be tested in other areas, or as Mona mentioned some of the examples. Throughout the US there were these types of programs, but they weren't done for everyone. They were done with a small segment of the population. And it was important to show that this is critical for all moms and babies, for the health of the community and for the health of those babies. And so that's another role that philanthropy can play, to support innovation and to bring programs to scale. And so that's another piece that we take very seriously. I think the other piece that's critical for philanthropy is to provide support and to encourage collaboration in public-private partnerships. We can't do this on our own in philanthropy. We don't have the ability to systematize, to do legislation, to do the rules and the structures that need to be in place to sustain at a population level or a state level or even a community-wide level the kinds of systemic changes that need to happen to really address these root cause issues and not just address symptoms. So those are, I think, three of the key areas where philanthropy needs to step up and continue to show the way.
So I've got a question. Dr. Mona, you touched on this a little bit, But I think we would be remiss if we didn't acknowledge we're here talking about these programs at a moment when we still don't have a state budget passed yet. And there's been a conversation from some of our colleagues in the other chamber about eliminating so-called waste, fraud, and abuse. So Dr. Mona, from your perspective, I mean, you've alluded to it a little bit about the long-term cost savings that a small investment now can be made. And as we consider, you know, talking to the community and coming back to Lansing, how do you see this type of investment and what do you lose if we don't invest in programs like RX Kids and TriShare long-term?
Yeah, thank you for that question. And I'm going to reiterate something that you said, Senator. We can't afford not to do this. Every hour that goes by, every day that goes by when a baby is born without the resources that they need to be healthy and to thrive is really a failure on all of us. If we do not invest in this critical window, we pay the price. We are paying the price when it comes to issues of health issues, chronic health issues, substance use issues, mental health issues, housing instability issues, even decreased life expectancy issues. So we are paying the price already of not investing in this window, a massive kind of, once again, societal underinvestment, which makes us so anomalous once again compared to the rest of the world. We are the only peer country that does not have paid parental leave. The only one, which makes it impossible for families to decide whether to have children and how to afford to have children. We are the only peer country that doesn't have, national health care. Or so many other countries, peer countries have things like child care. 70% of countries in the world have child cash allowances to support families during this critical window because they realize it is an investment that pays off. When you invest in this window, it reaps a lifetime of benefits. So I think about like our investments in like roads and bridges and infrastructure, which is important. I think Flint, more than anywhere else, knows how important it is to invest in infrastructure. But babies are also infrastructure. That we need to invest in babies because it pays off dividends in the short term and in the long term. And I think when it comes to efficiency, that's something that really so many legislators and championed about this program because it is so efficient. We're not growing government. It is, a seamless program. We launched 3 new communities recently: Clare County, Royal Oak Township, Hazel Park. We had no additional staff hired. It is a super lean and efficient program, so much so that the Mackinac Center for Public Policy, a very kind of conservative libertarian think tank in Michigan, released an article saying why they support RX Kids, mainly because of its efficiency, while also providing dignity and agency. I want to also kind of reiterate what our friend said earlier. We have data that show that this families have more freedom and choice to determine how to best meet their needs. They feel more empowered, they feel more respected, they feel more loved because it's not another paternalistic program out there that's telling them what to do. But because of its universality, because it's for everybody in the community, because it's unconditional, families get to choose how to spend that money, those 2 elements convey those important values, but it also adds to the amazing efficiency of the program. We don't have bureaucracy that are hired in this program to determine who's in, who's out, who's eligible, and what people are spending their money on. So super efficient program that really reaps short-term and long-term cost savings. I'll just add that the Flint Chamber of Commerce released a report a few months ago on why they support the program, because they see it as economic development. By and large, every dollar that is prescribed in this program, $1.6 is coming back and being spent locally. It is an economic stimulus. You can think of it as a trickle-up program. Moms and families are getting that money, they're spending it in small businesses, they're paying for their rent, and supporting landlords, and the list goes on. So even the business community supports this because of the economic development component of this.
So originally I came out of natural resources, and in the natural resources field we kind of have a mantra about the things that we do being for future generations. That's you're always thinking about what impact you're having on future generations. So when programs come across my desk that I see, I think that could have a long-term and when I say long term, I'm not saying my lifetime, but multiple generations impact, they always stand out. Jim, I know in your new role in the, well, relatively new role, in the Greater Flint Health Coalition, you're trying to change trajectories within our community. Can you talk about how how you see some of these programs impacting folks in the particularly extended long term?
Thank you, John. That's a great point. And I think it's critical to look at whatever program we're doing, as you mentioned, not just for now, not just for me, but for multiple generations. And, you know, we saw for the first time in, as far as I know, my lifetime, the city of Flint actually saw an increase in population. Obviously, our kids had something to do with that, a big part of that. But it also, and I think it also is saying to families, not just here anymore, but across the state, that we believe in you, that we support you, and that we want you to not just survive, but to thrive. I think these types of investments show families that we understand the struggles they're going through, and they're doing their best to make those efforts to make things a little easier for you. Nobody's asking for things to be done for them, or to make sure that no barrier gets in their way. What most families are asking for is to make my life a little bit easier. Stop putting barriers in my way, actually take some out of my way and make it a little bit easier for me. Help me make decisions. Let me make the decisions for what's best for my family. And let me do it in a way that empowers not just me, but, you know, as you mentioned, you know, kids, grandkids. And hopefully this will be around for when our kids have kids, John, and we're looking back as the old timers in our town saying, remember before our kids, and how families struggle. Now we can look back and say it's making a positive impact. I think it's really critical. As you mentioned, we deal with the kind of social determinants of health at the Greater Flint Health Coalition all the time, and I think we've seen an impact already in just the year and a half now that our kids has been in place. And I think if we continue to make these investments for the long haul, which you all are fighting for, we're going to see not just Flint, but all communities across the state thrive. And when families decide to have children, that they don't have to worry about the uncertainty that comes with it normally. This will be something that we can be proud of many years ago.
So if I can just add, we had the honor of testifying a few weeks ago at a Senate committee, and Chairman Austin Lowe's was there, who is the chairman of the Sioux Tribe of Chippewa Indians. And every community that we're in, we have local partners, and they're our local partner in the Upper Peninsula. We're in 5 counties, the program's in 5 counties in the UP. And somebody asked him a similar question, like, why are you supporting this program? Why do you think this is so important for your community? And he said that in Native American communities, they don't just think about 1 generation, they think about 7 generations. Like, what is going to be good for the next 7 generations? And he shared that this is something that not only will be good for the babies and the families today, but it's something that will reap investment and rewards for 7 generations to come, and I just thought that was beautiful.
So I think it's very important that we continue to expand this, and Dr. Mona, thank you for all your hard work and dedication to the families of Michigan. So can you just talk about how expected moms can sign up for this program and, you know, what the new service areas might look like?
Absolutely. So the program is plug and play. It's already built thanks to the initial investment in Flint. It's super easy for families to sign up. They just go to the website rxkids.org and they click apply here. The majority of families sign up on their phones. They then have to upload verification of pregnancy, and that requires a doctor's visit. So they usually upload, for example, an ultrasound or a doctor's note. They also have to upload verification that they live in the community that they live in. Our amazing partners who administer the program, it's an organization called Give Directly, a nonprofit. They're the international leader in cash transfers. They then verify the application. They make sure that it's a real person, that they really are pregnant, that it's not like somebody who's from a different community that's trying to sign up. And then after verification, families get their cash transfers. About 80 to 90% of families choose a direct deposit to a checking account, so just a seamless delivery of cash. About 25% or less, depending on the community, will choose to pick up a prepaid debit card. So that's the program. So we have a really robust safeguarding element to this to make sure that moms are protected, as well as fraud detection. But it is once again, there's a no bureaucracy program. Families get the cash. And the application's available in multiple languages. And if anybody needs any extra help, there's folks available to help them. Because of the philanthropic support, we love the public-private partnership. Families, when asked, like, who do you think is bringing this program? And they answer, like, my community is bringing this program. It is government, and it's academia, and it's nonprofits, and it's philanthropy, and it's healthcare. It's this big community, this big village that's coming together to bring this historic program for our moms and families. So the addition of philanthropy allows us to protect other public benefits, which is really important. The cash that is given to moms and families is considered a gift. It's not income. So it does not create something known as a benefits cliff. So families don't lose their eligibility for things like WIC and SNAP and Medicaid. So that is one of the incredible benefits of having philanthropic support for this program. In terms of expansion, the program is once again plug and play. It is ready to go. With extra dollars at the table, we can expand anywhere. So expansion is based on need. We will right now only kind of go to communities of high need, but once again, it's a public-private partnership. We have to have matching dollars to be able to launch in other communities. There's a couple communities that are itching to go. Ypsilanti and Saginaw have both raised some money, but they don't have all the money raised. And there are more communities that we hope to launch in Southeast Michigan. But there is not a day that goes by when I do not hear from somebody from another part of the state or another part of the nation who says, what about us? When is ARCS Kids coming to my community? I'm struggling, we're struggling, it's hard to make ends meet. And I've been so grateful to the leadership here who are committed to make sure that we can bring ARCS Kids so that every single baby in Michigan has that opportunity, that same opportunity to thrive and to be healthy.
Well, thank you very much. We're at the point now where we are ready to open it up for audience questions. If folks have, I see a hand here, a hand here, a hand here, and I'm just going to walk over to you and give you a mic.
Hi, I was just wondering, like, with a lot of WIC and SNAP and stuff like that, what is the income limit on this program? Because I'm sure there is one.
That was a great question. The question is, what is the income level for this program?
Yes.
And that is the beauty of this program. There is no income level. It is a universal program. It is for everybody in an ARCS Kids community. The income is based on the community. It's like a means test for a community. We only go to poor places, but it's for everybody in a poor place. And that is why we're able to achieve a really high take-up rate of near 100% because it's easy to understand that it's for everybody in a poor place. When you also do something for everybody, it makes it much more efficient, once again, no bureaucracy, but it also conveys a different set of values that we see you, we hear you, we know how hard it is to have a baby and to raise a child, and we are standing alongside you during this really critical period. So it conveys dignity and ultimately it conveys love.
Hi, good afternoon, everybody. I come here because of our ex-kids. I'm the manager at Region Community Partner Justice Center, and our goal is reunification. We go into the court, I hire parent partners, they go into the court, and we try to get children to return back home to their parents. And some of their risk factors could be anywhere from SAV, cognitive, homeless, and I'm just amazed that a lot of kids are removed from homeless. I want to share the benefit of our ex-kids. I deal with some of the lowest income. Our ex-kids come with dignity, number one. We have about 15 to 20 parents have benefit from our ex-kids. I mean, when they're homeless and the only thing keeping them from getting their child is a place to stay and they don't have the income. And to see that lift that this mom can take her kid home, she getting a $500. This particular case, she needed $1,500. She just needed $1,500, and she could take all 5 of her kids home. Thanks to Kenya, she comes to our organization and tell our community, because we work with different community resources to help parents get their kids back. And the lady was able to get the $1,500, to get the $500. And something I do notice, I don't have those cases. Once they get that money, I don't get repeated cases of kids leaving and coming back, because it's stabilizing them. So I'm not here to ask a question, but just to promote that when you first said it, it kind of like, I'm a taxpayer, I don't want my money doing this. But if you sit where I'm sitting, and my parent department, they work very hard to make sure that application, they take very good care of them, and they seem to take good care of the money that they get. So I appreciate RX Kids. I got about 35 more cases on my desk, which totaled up to about 100 kids need to come home, and without RX Kids, it would be impossible.
I just want to reiterate what she shared about child welfare. So child welfare is the Child Protective Services program. The peak age of child welfare involvement is the first year of life. Between 0 and 3 is more than double any other year of life. Children are investigated for allegations of abuse or neglect, and then often taken away from their home and placed into foster care. And then we as a society have to pay for that until they're 18 or so. And the toll it takes on families and their children. The peak age is that first year of life, largely because of poverty-related neglect. Because families don't, once again, it's the poorest time in people's lives, and families don't have the resources. So if somebody calls on them because the kid is dirty, or the utilities are off, or they have so much stress that they're neglecting the child. And this has not been shared widely publicly, but we have the statewide data for child welfare, and we are seeing, like in other studies of income support during this window, a significant reduction in child welfare involvement. Almost a 25% reduction in child welfare involvement. And I will just add that this baby, I'm going to borrow this right here. This is a real baby from our program. I will help you there, I'm sorry. This is a real baby from our program. Her name is Audrina. Mom had lost custody of her 2 older kids because she didn't have the resources. She was living in a shelter. This mom helped us actually build this program. We were listening to mamas. They tested the application. And while in a recovery house, she helped us plan and build this program. And she got signed up. She was one of our first families that were in the program. She got signed up. She was able to show the money in her bank account. She got custody back of her 2 older kids. And this mom says that this program made my family whole again.
Yes.
Because that should be all of our goals, is to keep families together with the resources they need. So this is a perfect example of prevention and saving all of us, especially the state money where we don't have to pay for child welfare. Thank you.
Hello, I have a question. I think it's for Jim, but I'm not sure. Back a couple of decades ago, in the bottom part of the millennium, there was a lot of research being done about the infant mortality rate. And we noticed that it was much higher in the African American community. Have you been maintaining any research on that? And if so, has this program affected those statistics?
Both hands on that one.
So that is a great question about infant mortality. So there are significant disparities in infant mortality. Black and brown communities have much higher rates of infant mortality, even if they're more well off than their white counterparts. This is a national crisis. We have one of the highest rates of both infant mortality and maternal mortality in the nation. The state of Mississippi actually just declared a public health emergency because of rising infant mortality, and I was just asked to testify before the legislature because they want to bring ARC's kids to address infant mortality. So we are looking at the predictors of infant mortality, and we've
improving those things. Things like access to your doctor, a decrease in prematurity, improvements in birth weight. All these things improve infant mortality. The definition of infant mortality is a death within the first year of life. The program has not been around enough for us to have that data because it's a 1 year out data. But we absolutely anticipate that we will be seeing those decreases not only in infant mortality, but also in maternal mortality, which is a crisis in our communities.
It's a great question, and I think more importantly too, Dr. Bonnie answered it tremendously, but I think we're also seeing a lot of the folks that work in the community in public health now, because of this catalyst of our kids now coming together saying, let's put all of our programs together, let's really attack this issue. We know we have the catalyst in our kids, but let's also use all of our other resources to make sure we bring this number down, especially in the Black community here. And I think it's not good at all in our community. It's extremely worse in the Black community. We have an opportunity to make an impact, make a big difference. Thank you for bringing it up.
My question is that both programs, RX Kids and Try to Share, just wondering how sustainable they are financially. Is it going to be a battle year to year? The legislature, how dependent upon private philanthropy are they? And is there some, would it require an act of the legislature to encode them as part of our expected services? I'm also wondering if the Tri-Share program, how feasible is it for smaller employers to participate in this financial?
Great questions. So on your last question, how feasible is it for small businesses to participate? There are a lot of small businesses participating already. We have really large businesses to small businesses. One of the great impacts of the Tri-Share program is that small businesses that are actually child care centers can participate. So that helps stabilize the child care community we have now, and also allows small businesses to participate in the program. And then as far as funding goes, Tri-Share has been funded for the last several years by the legislature and the governor. And it's a public-private partnership. And so we're working with businesses in order to go forward, that investment would need to continue. But we've got a wide group of stakeholders and families and child care providers who support the program.
Yes, just to respond to the sustainability of the program as well, I think that's one of the significant reasons why we introduced Senate Bill 309 so that we can codify it into state statute. So this program can be continual. And then from the budgetary aspect of it, I think one of the greatest things that this program brings is that TANF dollars can be used as a part of this program, which is for the assistance for needy families. And also, I think because we have a philanthropic arm and other private-public partnerships that help to support this program, it will be sustainable. We're reducing costs by making sure that families have the necessary resources available to them on the front end of a child's life, which also helps to reduce like CPS and other areas where the state is spending money in as far as like foster care and things of that nature. So I think it will be helpful to families to have those dollars and also make sure that they have that continuity as the baby and the mom and family continue to grow. So yes.
And I just want to add briefly, you mentioned we funded President Identified Priorities, and one of those is around economic opportunity. And one of those areas is child care support. So we fund organizations that are child care organizations, or in one instance, child care scholarships. And what we find in the data from the organization that is doing that program is that families are able to have more stable employment. They're able to complete degree programs
supported the Tri-Share, they came up with the Tri-Share program, but they also support folks that are trying to start child care facilities. They'll help them with support, whether that's resources or licensing, things of that nature. So this is a multiple years problem that's created, and they've been trying to supercharge it and get these things fixed. But like, it's really important. Is there sustainability? We believe there is, and I think what Senator Santana said, by trying to put it in statute, it'll make it much harder to cut it down the road. But there's a lot of supports going on, whether it's helping build out child care, whether it's Great Start Readiness programs and some of those available slots. We have a lot of work to still do, but we're in the process of doing multiple things at one time. These folks can chew and walk at the same time. Often government's not able to do that, but these folks have been showing in this space they've done a great job.
It sounds like a really great program. Y'all really think it will help the community. I have two questions. As a PA in this community, do you have statistics on the distribution and the demographics of how and who's getting funded in the families? And then what is a way providers in this community can connect patients and families and mothers who would be in need? Because this is my first time hearing about it, and I would love to refer my patients early on.
Thank you. That was a great question about the demographics of folks who are enrolled and then how to get people connected. So on our website, rxkids.org, we have a dashboard that updates every single week for all of our RX Kids communities, which once again are 11 communities across this great state, as well as each location. And on the dashboard, you can find exactly how much cash has been prescribed. We're almost at $15 million that has been prescribed, which is amazing, to over 3,500 families. You can find out when people signed up, and by and large, people sign up in pregnancy. Over 90% of people sign up in pregnancy. And then you can find the demographics of all the communities. You can see kind of the race and ethnicity information for the whole program and each community as a whole. And then you can also see families' reported income. So for example, in Flint, if you click on the income or that family support, I don't know, like 80%? Yeah, what is the numbers are shocking. Tell me the number.
The Flint numbers as of this morning, 10,853 cash prescribed, 1,994 families enrolled, and 1,780 babies.
Yeah. And we have a data use agreement with the birth certificate, so we know actually how many babies are born in each community, and we match those with how many people are signed up for the program. And once again, we have about a 100% take-up rate. So everybody who should be in the program is in the program, which is amazing. Other programs during this window, like WIC, have about a 50% take-up rate. So everybody is signed up, so the demographics match the populations. So for example, in Flint, we have about a 60% Black population, 30-something% white, and others. So our demographics, wherever we are, pretty much match the demographics of the community. That high take-up rate means families are signing up, so they do know about it. The most common ways that people do find out about it are friends and family or social media. In my clinic upstairs, I ask every baby, every family with a baby, like, how did you find out about it? And the answer is usually like 12 people texted me when I was pregnant. Or I saw it on social media and I didn't believe it. I thought it was a scam. I couldn't believe that, that I was going to be able to be eligible for such a life-changing program. Then they find out it's not a scam and they sign up. But we have posters and materials for anybody who's interested to share more. But people are finding out about the program, and I think that really speaks to the popularity and the value that people find of it.
Good afternoon. My question is, congratulations on the success of our Kids program. I refer numerous parents, moms, to RX Care every month. My question is, the state of Michigan just recently announced a doula program, and they are sponsoring that all over the state. Is there any connection going to be made between that doula program and RX Kids possibly in the future?
That's awesome, and we share in every community that we're in, local and state and national resources to connect families. What we're seeing is that families, because of the economic stability, have more bandwidth
They have less stress, and they're more able to take up other things. So we have an increased sign up for WIC, and we have more people going to prenatal care. So we don't mandate or make people go to other things, but we are seeing that folks, because they have that ability to breathe, are taking up more things, and we're always happy to share different resources.
Hello, everybody. My wife is a senior, and I represent the group. I want to tell you that I represent the Roundtable Coalition. And I want to say thank you to everybody in here, because this is a part of our world of the children in this city. I want to help them. I want all the things that you said, well, I really enjoyed listening to them. Now, I want to thank the Ruth Mott Foundation, because you know what? Over the years, you have funded me to be able to help the children in my community. We've got homeless people in my community, and the children, and we've been able to feed them. I was so happy that Senator Cherry and Senator Anthony came out and read to the kids. We had a family out there that had lost one of the children that had come out to one of our story hours, and we had one of the pastors from our church come out. And at church, they came there and they said, boy, they felt love. I wanted to say that to you. I wanted to say that to you because that was a special day in my life. So I'm very grateful to the Ruth Mott Foundation for all that they've done over the years for us. We've had a lot of people, when we really had a great garden this year. So thank you very much.
Jim Thompson. I live right down in Curzon. And my wife and I raised 6 children. I would say we were very fortunate. We started off with twins. And the fortunate thing was that we had an insurance policy. It was called Twin Insurance at Bourbon's in Dayton, Ohio. If you took out a policy at the store, you would get double all the baby gifts. So, the people would ask us, what do we want? We said, diapers. That was cloth diapers. I still wash my car with some of them. Left over. Because I had to get a shed to put the diapers. And we followed up shortly thereafter with not another set of twins, but a terror, a tyrant, who gave us a lot of problems. But I didn't come here to tell you about my own life. What I want to say is that this is an impressive panel. You have done something that is benevolent, and it will last. And it started right here in Flint. And because of you all, and especially Mr. Jim Ananick, this will be carried on. He knows about partnerships and developing coalitions. And he's the right man for the job. And Doctor, you are the right person for that job. Thank you. I'm glad you shared my sentiment. On October the 2nd, coming up next week, the Jim Ananick Foundation Bash. The occasion others. He's a servant leader, as I surmise you all are. You proved it to me today. And the good thing about this bash is it's right here in this room. And if you don't get your tickets,
I was wondering, are you going to follow each one of these babies that are enrolled in this, and for how long?
So the question was about following the folks that are in ARCS Kids. So we absolutely want to see how the kids are doing. And if we get more money for research, we will do that long-term follow-up. But the neat thing is that because the whole population of children are enrolled, we can use other big data like kindergarten readiness data, third grade reading data, and other health outcomes, rather than like staying connected to every single person. But absolutely, we hope to follow up. I'm going to touch on the diapers a little bit. So we know what families are spending their money on in this program, and the number one thing that families spend their money on is baby supplies. And we ask more questions about what baby supplies, it is diapers. So even to this day, diapers are the biggest expense that families are saying that they're spending this, and then it's food, and then rent and utilities. So not much has changed.
Well, we have run out of time, so I just want to extend a thank you to all of you for coming to the roundtable, my colleagues, both for coming out and also all the work in putting on initiating and expanding the program. And thank you to our panelists for all the work that you have done to help not only Flint kids, but children across the state. Thank you very much. And afterwards, if you want to come up and talk to a panelist and have questions, we have more time for folks to talk to you. Thank you very much.